Lambert-Eaton Myasthenic syndrome is a rare autoimmune disorder that affects the voltage-gated calcium channel in the presynaptic motor neurons. Normally, when action potential travels along the neuron, the voltage-gated sodium channels open, allowing sodium ions to enter into the cell. This causes a positive electrical gradient and triggers voltage-gated calcium channels to open up, allowing calcium ions to enter into the cell. This triggers the release of acetylcholine, which binds to nicotinic acetylcholine receptors on the muscle cell membranes, triggering a series of reactions within the muscle cells that lead to contraction. In Lambert-Eaton Myasthenic syndrome, the immune system mistakenly attacks the body's voltage-gated calcium channels on nerve endings and thus decreases the release of acetylcholine. This results in weakened muscle contractions. There are two main forms. Paraneoplastic form is often associated with small cell lung cancer. The cancer cells express proteins that resemble calcium channels, triggering an immune response which also targets the body's own calcium channels. In 40% of patients, it is a non-paraneoplastic phenomenon. The exact cause remains unknown, but it is believed to be autoimmune. Common symptoms include muscle weakness, reduced or absent tendon reflexes, and autonomic dysfunction such as dry mouth, constipation, blurred vision, and erectile dysfunction due to the involvement of the autonomic nervous system. Muscle weakness typically involves the proximal muscles, such as those in the hips, thighs, and shoulders. This can lead to difficulty climbing stairs, rising from a seated position, or lifting objects. When the patient performs the repetitive movement, it causes more depolarization and the release of acetylcholine into the synaptic cleft. This post-exercise facilitation causes temporary improvement, which is the hallmark of Lambert-Eaton Myasthenic syndrome. Investigations that can help to diagnose Lambert-Eaton Myasthenic syndrome include blood tests to detect antibodies against voltage-gated calcium channels and electrophysiological studies, which will show reduced muscle activity that increases with repetitive nerve stimulation. It's also important to check for underlying cancers, especially small cell lung cancer. Treatment aims to manage symptoms and address any underlying conditions. For paraneoplastic Lambert-Eaton Myasthenic syndrome, treating the underlying cancer can lead to significant improvement in symptoms. For symptomatic treatment, amifampridine, a voltage-gated potassium channel blocker, can be used. Blocking potassium channels prolongs presynaptic cell membrane depolarization. This enhances calcium transport into nerve endings, increasing acetylcholine release into the neuromuscular junction and thus improving muscle strength. Pyridostigmine, an acetylcholinesterase inhibitor, can increase the levels of acetylcholine at the synaptic cleft. Corticosteroids and other immunosuppressants, such as azathioprine or methotrexate, may be used to reduce the immune attack on calcium channels. Intravenous immunoglobulin and plasma exchange can be used in more severe cases or when other treatments are ineffective.